Hi, I'm Lisa Washburn, Associate Professor and Community Health Specialist with the University of Tennessee Extension. I'm part of the Professional Development Team for the Well-Connected Communities Project. I'm pleased to share with you a training developed to help you understand how factors called social determinants impact health for individuals, families, and communities. Conditions in places where people live, work, learn, and play affect health outcomes. These conditions are called social determinants of health. This module will help you to identify root causes of common health issues, describe examples of interventions or programs addressing social determinants of health, and use social determinants of health to determine priorities for well-connected communities' master volunteer work. Before we dive into this module on social determinants, let's first discuss the dictionary definition of a determinant. Determinant is defined as a factor that decisively affects the nature or outcome of something. In this module, we are looking at determinants or factors that affect health status or health outcomes. It might also be helpful to define social. The dictionary definition of social is relating to society or its organization. Synonyms for the word social are community, collective, group, and public. So one way to describe a social determinant at a very basic level is a community or societal factor that affects the nature or outcome of something. In this case, that something is health. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now that we have defined health, let's define social determinants of health. Social determinants of health are the circumstances where people are born, grow up, live, work, age, and the systems put in place to deal with illness, such as the healthcare delivery system. Circumstances are often beyond an individual's control. Likewise, the social determinants of health listed here may be outside of an individual's control as well. Healthy People 2020 addresses social determinants of health, abbreviated here SDOH, in the goal to create social and physical environments that promote good health for all. While several organizing frameworks exist for social determinants, Healthy People 2020 uses a place-based organizing framework, which reflects 5 key areas of social determinants of health. These 5 key areas, or determinants, include economic stability, education, social and community context, health and health care, and neighborhood and built environment. Let's look at how the social determinants of health relate to the social ecological model. As individuals, our health is impacted by our family and friends, the organizations of which we are a part, the community, and society. The social ecological model provides a framework for thinking about the many influences on health and behavior. Often, these influences interact. The social ecological model suggests that health is affected by the interaction between the individual, their friends and family, referred to as the interpersonal level, the organizations they are part of, such as work sites and faith-based groups, and the community. We are also affected by physical, social, and political environments. People are impacted by the context in which they live, and likewise, people influence others and the environments they live in. This can be very basic, like providing healthy food in your own household. It can also be very complex and policy-oriented. It can be positive and improve health, or negatively influence health. The influence of social determinants of health can be seen within levels of the social ecological model. Most often, these influences work across multiple levels of the model. The main idea with the social ecological model is that programs should target individuals and impact the interpersonal, community, organizational, and environmental factors influencing health. Addressing multiple levels helps programs to be most effective. And the main idea with this module is that the social determinants of health should also be considered to help programs be most effective. We should look not only at the causes of health issues, but the causes of the causes. The next few slides feature some health-related trivia questions. As you think about the questions and their answers, consider what community or societal factors might influence the health outcomes of interest. One of the most fundamental ways we measure health and make comparisons between the U.S. and other countries, or between states and counties in the United States, is with life expectancy. Life expectancy is the average period that a person may expect to live. It varies depending on where you are born and live. How do you think the U.S. compares with other countries in the world in terms of life expectancy? Do you think that we rank number 1? In the top 5? In the top 10? Do you think that we're in 20th place? Or the last answer option, 29th place? The answer, E. The U.S. ranks 29th place. With a life expectancy of 77.9 years, we are tied with South Korea and Denmark, despite being the second wealthiest country on the planet, as measured by per capita gross domestic product, or GDP. Per capita means for each person. In this context, it relates to population size and GDP. Japan has the highest life expectancy at 82.3 years. Based on the general correlation between GDP per capita and health, our average life expectancy in the U.S. should be 3 years longer. Even citizens of countries considerably poorer than ours, including Costa Rica, Chile, and Greece, live longer on average than we do. Why do you think that is? What in our communities, what societal factors could be driving these life expectancy rates? Next, let's consider where the U.S. ranked in life expectancy around 50 years ago. Do you think the U.S. ranked number 1, in the top 5, in the top 10? Do you think we ranked 20th place? Or the last answer option, 30th place? The answer is B, in the top 5. In the 1950s, life expectancy in the U.S. was at 68.2 years and longer than most other countries. Interestingly, we had less economic disparity back then compared with other countries, even Sweden. But especially starting in the 1980s, the gap in the U.S. between the rich and the rest of the population began to grow. Around this time, other industrialized countries began to prosper and rapidly passed us on many health indicators. Economic disparity is connected to income inequality, or the gap between what wealthy Americans earn compared with non-wealthy Americans, the middle and lower economic classes. In 2015, the top 1% of families in the United States made more than 25 times what families in the bottom 99% did. How do you think this difference in wealth and income impacts how long people live? What in our communities, what societal factors impacting life expectancy are connected to these large gaps in income? Our next question relates to factors predicting individual health. Of the factors listed, which do you think best predicts one's health? A, whether or not you smoke. B, what you eat. C, whether or not you are wealthy. D, whether or not you have health insurance. Or E, how often you exercise. The answer is C, whether or not you are wealthy. The single strongest predictor of health is our position on the class pyramid. Those at the top, those with the most wealth, have the most power and resources, and on average live longer and healthier lives. Those on the bottom, those with the least wealth, are exposed to many health threats over which they have little or no control. Low-paying jobs with little job security, poor childcare, poor quality housing, less access to healthy food, unreliable transportation, and living conditions that are noisy and violent. These health threats increase the risk of chronic disease and early death. Even among smokers, smokers who are poor have a higher mortality risk or risk of dying than rich smokers. Americans in the middle of the income spectrum fare better than those at lower incomes, but are still worse off than those at the top. Thinking back to the term social determinants, are there factors in our communities and organizations that affect health outcomes for those who are not wealthy? What are some of those factors? This is our last question. Chronic stress increases risk for many health problems. Of the conditions listed on this slide, which is not impacted by chronic stress? Hypertension, obesity, sickle cell anemia, preterm birth, or diabetes? The answer is C, sickle cell anemia. Sickle cell anemia is a genetic disease that is inherited from biological family members. Chronic stress is a risk factor for all the other conditions listed. Our body's reaction to stress, when stress is constant, can wear down our systems over time and increase our susceptibility to disease. These stressors can be exposure to violence, economic insecurity like not having enough food or not knowing whether we can pay the electric bill, and racism. Those who are lower in the social and racial hierarchy have more exposure to stressors that threaten health. They also have less access to resources that help cope with problems. Chronic stress is constant and persists over an extended period of time. Chronic stress can result in serious health conditions, including anxiety, insomnia, muscle pain, high blood pressure, and a weakened immune system. It can contribute to the development of major illnesses such as heart disease, depression, and obesity. Many communities undertake initiatives aimed at improving the health of citizens. Often, these initiatives are intended to change individual behavior by offering opportunities and information that make it easier for people to quit smoking, get more exercise, and eat healthier foods, or obtain health screenings for various diseases. While these programs can lead to good outcomes, they often don't address the social determinants of health that are at least partially responsible for positive or negative health conditions in a community. Social determinants are complex. Sometimes focusing at the individual level is easier for communities, but it may not be the most effective way to improve health. Let's look at an aspect related to social determinants of health and communities. Health starts in our schools, homes, and communities. Think for a moment about that statement. Look at the two pictures. How might differences between communities impact health for people who live there? The next slide features a video on the social determinants of health. The video is about 6.5 minutes long. After the video concludes, we'll join back together and discuss more about social determinants.
Hi, and welcome to this video on the social determinants of health. This is a very important concept to understand because its impact on the health of individuals and of populations. We'll be taking a look at what it is, how it impacts health, and a useful framework to understand it. Take a look around you, your family, friends, and other people around you. What's clear is that health is quite variable, not just between individuals, but also across different population groups. Let's take an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years, a difference of 33 years. But there are differences even within countries. For example, in Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with higher income, a higher level of education, and a better occupation have better health and a greater life expectancy. Health status can change as well. For example, studies of migrants have shown that the type of diseases, health behaviors, and risk factors are different in migrants compared to those in their country of origin. So why is there so much variability? To answer that question, we must understand the factors that can influence health. Let's have a look. A person's health is influenced by a range of factors called determinants of health. These include who they are, individual factors such as age, sex, and genetic makeup, and also what they do. This includes their health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age. These include their social and community networks, the socioeconomic, cultural, and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at an international, national, and local level. They have a marked influence on health inequities, which is the unfair and avoidable health differences between different groups of people within countries or between countries. Now, there are many different social determinants of health, working across many levels and with complex interactions between them. So, to understand and explain how these determinants influence and interact with each other to affect health and well-being, several models or frameworks have been proposed. There are many different frameworks that do this, but let's have a look at one useful framework developed by the World Health Organization. According to this framework, there are two broad types of health determinants that influence health and can lead to health inequities. These are structural determinants and intermediary determinants. Structural determinants refer to the socioeconomic and political context in which a person is born into and lives in. These include governance, how society organizes itself to make and implement decisions, economic, social, and public policies, and also the social and cultural values that communities place on health. These factors can determine and lead to the unequal distribution of material and monetary resources, which shapes a person's socioeconomic position. The socioeconomic position describes a person's place in society, which can affect their exposure, vulnerability, and outcomes to conditions that have an impact on their health. The socioeconomic position is determined by a number of factors such as education, occupation, income, gender, race or ethnicity, and social class. The socioeconomic position in turn affects the intermediary determinants of health. These include material circumstances, like the quality of housing, the financial means to buy healthy food, clothing, or other requirements for healthy living, and also the work environment. Psychosocial circumstances, like stressful living circumstances, relationships, and social support. behavioral, and biological circumstances. In addition to these, health systems have an impact on the type and quality of healthcare available to people. It also determines how easy it is for people to access health services and receive the healthcare they need. Social cohesion and social capital are factors that bridge the structural and intermediary determinants. They describe the willingness of people living in a community to make sacrifices and to cooperate with each other for a wider benefit. Intermediary determinants influence health and health inequities. It's also important to know that the links between these different factors are not always linear, but are complex and can go in both directions. For example, poor income and education can impact health, and also poor health can limit opportunities for people to participate in the workforce or receive education. Also, if population is affected by a lot of disease, it can have a broader impact on the socioeconomic and political context. So how can we change or influence these determinants? Addressing the social determinants of health is not an easy task. It involves identifying the structural and intermediate determinants of health and taking appropriate actions to improve them. To do this requires actions across all sectors of society and at all levels, including local, national, and international. The actions will depend on the existing socioeconomic and political context, resources that are available, and commitment for action. And that's a quick introduction to the social determinants of health. We've had a look at what it is, how it impacts health, and a useful framework to understand it.
As you can see, social determinants of health are complex, and you may be wondering how you, in a volunteer role, can influence change for such large issues. The drawing on this slide is taken from the video you just watched. To review, both structural and intermediary determinants impact health. Structural determinants include socioeconomic and political context, which influences an individual or group's socioeconomic position. Socioeconomic status is influenced by a person's education level and occupation, their income, gender, ethnicity, and social class. Intermediary determinants include one's material circumstances and biological factors like genetics. Psychosocial factors are factors involving both psychological and social aspects, or social conditions relating to mental health. Psychosocial health refers to one's mental, emotional, social, and spiritual health. Health systems also come into play to impact health. Finally, this graphic shows a gold rectangle intersecting socioeconomic position, the blue box, and the intermediary or linking determinants listed in the light red box. The gold rectangle is intended to show how social cohesion and social capital can bridge gaps or deficits in some structural determinants. Social cohesion and social capital can be built. In fact, your involvement in this health volunteer program involves some social cohesion. As you can see, the relationships are not direct. There is no single straight line to get from poor to good health or to influence a single social determinant. These factors do not exist in isolation. It may seem daunting, even impossible, to address complex social determinants of health through your volunteer work. But we all have a role to play in improving health in our communities. Social determinants of health can be addressed through developing community leaders, supporting social networks, and fostering a sense of community. The Master Volunteer Program you are participating in is an approach to address social determinants. The hope is that you will become more engaged in your community, both through your structured volunteer work and within your personal networks. This engagement will contribute to improving health outcomes beyond the individual level. Your work will improve health for others. Increasing access to community resources may be one of the clearest ways health volunteers can address social determinants. But as we work to do this, we must consider the barriers to accessing such resources. For example, imagine that you partner with an extension professional to offer a series of healthy cooking classes in a low-income community. You are well prepared for the first session and you're really excited about the difference the program can make. But no one shows up. Disappointed, you might conclude that no one was interested in attending and cancel the remaining sessions. But the reasons for a low or no turnout may be more complex. Considering social determinants means to look at the causes of the causes, to ask why. For our series of cooking classes, we might ask, why did no one show up? There are a range of possible answers. What would your answer be? For the sake of illustration, let's say the response is because they did not know about the session. To dig deeper, we would ask, why didn't participants know about the session? Think for a moment. Why, in this situation, might participants not know the session was occurring? It may be that participants did not know about the session because they did not see the flyer placed on the community bulletin board. And to dig deeper still, we might ask, why didn't potential participants see the flyer? Think for a moment. What are some possible responses here? Let's assume that participants did not see the flyer because it was placed in an unlit area and they get home from work after dark. This is an oversimplified example, but you get the point. Asking a series of whys to tough questions can help drill down to the root cause. In this overly simple example, there are other factors to consider. For example, perhaps the class was held during the day and participants would not have attended due to work conflicts. The point is, we can't stop at the conclusion people simply are not interested. It is never that simple. For the sake of illustration, let's look at a model for addressing complex issues. This is called the stray dog model. Let's imagine your community has an issue with stray dogs. And this is what the community has identified as a key issue impairing their growth and development. We might start first by asking, why are there stray dogs? Possible reasons are that there's no leash law in your town, a policy issue, or that there is no dog catcher, which might be an issue of local tax revenue, or of animal control being a low priority for your city. Other reasons might be that people turn their unwanted dogs loose, or that they don't spay or neuter their pets, which leads to increased dog population. As you can see, each of the 4 possible reasons why there are stray dogs has additional underlying reasons or causes, root causes of the issue. It is complex, but the more we ask why, the closer we get to identifying the real issue. Let's take the stray dog example one step further and examine how this is a social determinant of health. Recall that social determinants are the circumstances where people are born, grow up, live, work, and age that influence health. This is a real-world example. One rural community was heavily impacted by diabetes. They also had high obesity rates and physical activity levels were low. A group in the community decided they wanted to do something to address the diabetes issue. Knowing that regular exercise can help prevent diabetes, especially among those who are pre-diabetic, they decided to look at how to get folks to exercise more. They did some focus groups to find out what types of exercise people were likely to engage in and to identify the barriers to being active. It turns out that the biggest barrier to people getting out to walk in their community was, you guessed it, stray dogs. This community had an animal control issue. People did not feel safe going out to walk in their neighborhoods or on a rural road because they were afraid of all the stray dogs out. This made addressing the stray dog issue the most important first step to address diabetes. In this example, stray dogs were a circumstance or condition where people lived that negatively impacted their health because it limited the physical activity, walking, that they were most likely to engage in. Let's look at one volunteer group's project. This group lived in a rural community with a high poverty rate. The community was food insecure because of low income levels and because the nearest grocery store was 15 miles away. This posed a barrier for those with no transportation or for those with limited resources to pay for fuel to get into town. The volunteer group decided that they would establish a food pantry to address this need. The food pantry would operate through a local church and be supported by donations, both monetary and donations of food items. And they partnered with an extension nutrition educator to make sure they had nutrition information and healthy recipes on hand to distribute to food pantry patrons. You can already see the influence of social determinants of health on people living in this community. They may have relied on shelf-stable foods, perhaps highly processed, as these tend to be lower cost, and purchased fewer fresh foods because trips to the grocery store were infrequent. The volunteers organizing the food pantry recognized the important role they could play to increase food access overall and also to increase access to healthy foods. They wanted to be a source of healthy food items for the community. So instead of merely asking for donations of canned goods to the food pantry, they put together a set of donation guidelines. This included recommending donations of canned goods labeled as no salt added, with an aim to lower sodium consumption, and asking that donors avoid contributing sugary beverages such as fruit-flavored drinks and sodas. They also helped patrons apply for SNAP benefits to extend their food dollars when they traveled to the grocery store. SNAP stands for Supplemental Nutrition Assistance Program. Benefits under this program were formerly referred to as food stamps. In addition, they provided transportation by organizing trips to the grocery store using the church van. The next project example comes from another rural county. The group of health volunteers in this county determined that while many needs existed in their community, there were also many resources. The problem was that service providers often saw clients with complex needs that their agency or organization was not equipped to meet. They would rely on their local network to send out referrals. Limited connections meant some service providers were overwhelmed with referrals, while others received none. People were not aware that they existed, or they didn't realize the range of services provided. You can see the issue here, a high-need community where folks really wanted to help their neighbors. They just lacked the network to meet existing needs with existing resources. This volunteer group investigated the issue. They found a resource list developed in the past. It was very outdated. They partnered with the local hospital and collaboratively conducted a community scan to vet the services available, starting with the outdated resource list. They reached out either by phone or in-person visit to every resource on the list. They found that some of the organizations listed no longer existed. They found others that were new to the community, or some on the list had expanded their services. This volunteer group worked together to vet and compiled an updated, comprehensive resource guide, which is housed on the local hospital's website, available both for service providers and for community members. Here's another example of a master volunteer project addressing social determinants of health. Volunteers in one community were shocked when they learned their county had among the highest opioid prescribing rates in the state. They dug deeper to find out what conditions opioids are prescribed for. They discovered that they were commonly prescribed for chronic pain. Wanting to know more, the volunteer group worked with their county extension educator to determine a course of action. They learned that treatment guidelines for chronic pain recommend that non-drug treatment options be tried first. And they looked into these non-drug treatment options: exercise, cognitive behavioral therapy, self-management programs, and physical therapy, and their availability locally. They found very limited access. Repeated visits to physical therapists, most located an hour away, were cost prohibitive for many. Fitness facilities for exercise classes were expensive, and no self-management programs for chronic pain were available anywhere nearby. So the volunteer group worked with their county extension educator to identify how they could meet this need. They found several program options that included lay leaders in teaching. Group members got certified as program lay leaders and began offering chronic pain self-management programs at sites throughout their community. Programs were offered in partnership with local healthcare providers at sites convenient for patients, like churches, community centers, and clinics. This locally tailored approach helped overcome several barriers: transportation and limited access, to be certain. Additionally, volunteer lay leaders are effective at fostering social support and generating social cohesion. Because volunteers were involved in program delivery, social determinants relating to social cohesion as support were present. Here's our final example of a master volunteer group addressing social determinants with their community work. In this community, like so many across the United States, there were high levels of hypertension, both undiagnosed and diagnosed. High blood pressure is sometimes called the silent killer because it usually has no warning signs or symptoms. Many people do not know that they have high blood pressure, and that's why it's important to get your blood pressure checked regularly. High blood pressure is a leading cause of stroke, so it's important to keep levels within the recommended range. People who have low incomes may not be able to afford a blood pressure cuff to keep at home. And while many retailers have blood pressure stations where people can check blood pressure for free, those without transportation and those residing in rural areas may not have access. Recognizing this as an issue, one master volunteer group brainstormed how they could help people monitor their blood pressure and teach the importance of stroke prevention and how to keep blood pressure at healthy levels. They decided that local libraries would be a good partner. The libraries were located on the city's public transportation route and were a site that many community members visited regularly. So after they obtained permission from the local library system, they raised funds to purchase and install stationary blood pressure monitors in the libraries. They worked with library staff to let people know about the monitors and to raise awareness of the need to monitor blood pressure. Their county extension educators supported the effort by training volunteers to present educational programs. And the library staff helped make sure patrons measuring their blood pressure documented their levels. They even provided referral information for those with elevated blood pressure levels. The examples discussed here are just a few ideas of how social determinants of health can be addressed through your master volunteer work. The main idea is to consider the health effects of issues, even those involving stray dogs, and figure out their root causes of community problems. Sometimes there is a simple solution, but often the solution is more complex and may require partnering with others to influence community level change. It may be that a community organization asks you to partner with them because you can meet needs that they can't. So, be ready to answer the call and look for the causes of the causes.